Today we received a rather grave and disappointing report about the way that this country has an attitude towards mental illness. Now, there is no great surprise when people like myself talk about how important the issue is on television. We've all been aware of the awareness. But there is one stat that I wanted to point out, and if nothing else sinks in tonight, if nothing else made any sense to you today, please take this stat and use it at every barbecue for the next few weeks. 45 Australians commit suicide every week of every month in the past 12 months. 45 people. It's well over 2,000 people who felt alone and felt that there was no other option than to end their life in this beautiful bloody country, in the gorgeous cities that we live in with the family and friends that so much of us have around us. 45 people every single week chose to end their own lives. That number would be even higher if we were able to work out exactly what was behind many of the motor vehicle accidents that take people's lives, many of the other sorts of accidents and grey areas. But that number is scary enough. 45 people every week. Now, I'm heartbroken by that. For all of the conversations, for all of the awareness days, for all of the raising money, for all of the political platitudes, for all of how much we supposedly care, clearly there are 2,000 people who didn't think that we did. And that matters more than a political scandal. It matters more than the result of any sporting match. I don't know what the answer is, but please pay attention to what's going on at the moment. This is more interesting and it is more important than sport or politics or entertainment. It's real life. And the fact that 45 people that might potentially be watching this show right now will choose to end their own life and not be here for that conversation in a week's time scares the living out of me. Let's talk about it. A report was released today and was put together by Professor Alan Fels, who was the former boss of the ACCC. And in that report, which was so much to talk about, that we're all great at talking about things, but what about doing something? 45 people commit suicide in this country each and every week. Professor, it's nice to see you. I'm sorry we talk on days like this when occasions like this come up. When that number, and I've heard the 1 in 5 are affected by mental illness a million times before, but there is something so devastatingly sad that 45 people every week of every month, all year in this country, end their own lives.
It should cause us to stop. We should stop and think about that every year, and we should stop and think about it every month. Yeah. And in fact, every week, as you point out, it's a lot of people. It's much more than the road toll. It's a very significant number. It's much more than many other illnesses that we talk about a lot and provide care for. And the really difficult thing is we haven't really made a serious dent in those figures in the last 10 years. They're pretty stable, and there's some suggestion they might be creeping up in tougher financial times, when we really can do something about it. You know, we know what to do, and I've personally been part of many reports and many suggestions and attended many political events where people have committed to making a difference. But really, we've got to get on and make a difference. We have to do the things that change those numbers.
You've got some great concrete ideas, and I want to talk about those in a second, but let's get into the numbers as best you know them. Is there one age group that stands out? So much attention is given to young people that are bullied, but that's not actually the big number.
No, men.
Yeah.
A bit like you and me. We're the biggest risk. So men in midlife actually have the highest rates of suicide. Often they've been in trouble for a while. They've been depressed, they've had trouble at work, they've started drinking, their wife's left them, they're on their own. And that whole vicious cycle ends in being isolated and distressed and alone, and people attempt to take their own life and do so in a way that unfortunately results in their death. That's the group at greatest risk. The problem often comes to a head then in middle age and men who are in trouble and who are isolated, who are not connected in one way or another. But the problem often starts, in truth, many years later. Many of us are shocked when it happens, and we assume the problem only started last week, or very quickly, or no one knew, or no one could have done anything. The reality is that many suicides are preventable, but by taking action much further upstream.
And that's where you've had an idea for a long time. We even spoke about it on this show. I think it was last year. In the same way that we have medical centres, one big shiny building where you go in the front door and one doctor refers you to another, all in one big, nice, new building. we should have the same for mental health issues. And it's not going to cost billions and billions and billions of dollars. In fact, you told me today it's going to cost a bit less. But tell us about the need for, not on every street corner, but geez, quite a few in the big cities, the one-stop shop.
Well, you know, when you go to a medical centre or you go to a big hospital and something serious, you go cancer care, you know the x-ray department's there, you know the surgeon's there, you know the radiotherapist's there, you expect to get the whole deal. Not to be sent around to 15 different addresses and never get, oh, sorry, we don't do radiotherapy, oh, sorry, we don't do surgery, sorry, we don't do x-rays here. Go sort it out yourself. Well, just in mental health, particularly mental health for young people, that's what you need. Easy, accessible, new, welcoming, people who can work together and provide at low cost and easy accessibility those centres. Now, where that's happened, particularly under the Headspace movement in Australia and other co-located centres, guess what? People come. Even men, even young men. In the centres we run, half the people who come are young men. People who said, oh, they'll never come. They'll never take the kid. They do. And when they get there, the service has to work. We have to have our act together to provide the range of health services, psychology services, housing and support, education support that you really need. And that's the challenge. And it is cheaper. That is the thing. Just think about it. If you have to rent 10 premises, have 10 secretaries, 10 receptionists, 10 phone systems, 10 ITs, it costs a lot more than well-integrated systems that perform together.
See, because no doubt the people watching us in Canberra who are in charge of these things will say, oh, but they're really missing the secret costs, which is the extra doctors and the people who need to assist them. Knowing this field, are there enough psychologists? Are there enough clinical nurses? Are there enough people to man these things if suddenly a billionaire decided, all right, go and build them?
Yeah. We have lots of people who want to work in this field. People think mental health's a bad field to work in, but actually people love it. They make a really big difference in people's lives. But they need to work together, they need to be coordinated, and they need to be where a lot of the people in trouble are. So they need to also practice in the outer suburbs and the outer regional areas of our big cities, in the big regional centres. A lot of the commission I've been associated with has gone to the country where there's a lack of services. They need to use new technologies, particularly the web-based technologies. We can do lots of stuff online that other parts of medicine can't do. So we have lots of ways of doing it better if we want to do it, if we get serious. I've had a great pleasure this week going to the 30th anniversary of the arrival of HIV/AIDS in Australia. Now, there's a great threat and a tragedy. But guess what? Australian doctors worked with a community to get organised and we have the best results in the world. When we want to do something, we can do it seriously. And reducing suicides like that, we know what to do. We know how to connect with young people. We just don't get organised and we just don't have the degree of seriousness that you had at the start of the show. We just don't get serious. Every week we need to make a difference. Every day there are lives to be saved. Young lives, and particularly blokes like you and I. People who are actually in the prime of their life, in the middle of families, in the middle of their community, people who really matter, but they get lost. They get lost from their job, they get lost from their workplace, they get lost from their community, get depressed, using alcohol, and sadly feel they're of no value. When really, they're incredibly valuable. You know, they're my brothers, they're my relatives, they're my parents, they're my children. And that's the kind of perspective we all need. It's our families that we're talking about who are affected when this goes really wrong.
Professor, thank you so much for your work. We'll talk to you many times between now and an election campaign. This thing should really matter. Again, congrats to you and your great team.
Thanks, Paul.
Thank you very much.